Our top story, rider advocates and Boston Mayor Kim Janey call on the MBTA to reverse funding cuts for routes and service levels. Citing a drop in ridership, the T recently suspended some bus routes and cut back service levels on most rapid transit lines by 20%. Elected officials and advocates note this also comes after the T received a new infusion of federal relief money and with more expansion of economic reopening.
If you're someone who's never owned a car and you've relied on transit throughout the pandemic and your bus line got cut, you literally have no other options. Your ability to get anywhere or do anything has been cut, and that might mean that you don't get to the grocery store, you don't get to healthcare, you lose your job.
And when public transit doesn't work, we see what happens to families. We see what happens in terms of barriers, in terms of public transportation and public education. We see what happens when people can't access the food and the basic services, healthcare that they need. And so it's really about making sure very critical populations that are already suffering during COVID have the needed access they can to mobility and access these critical services.
What makes Massachusetts so special, what makes the city of Boston so special, is that we bring the smartest people in the world together in small spaces, like downtown Boston, Kendall Square, the Longwood Medical Area, downtown Worcester. That only works when we have a thriving transit system. And so we must bring this service back because transit is essential to the Massachusetts economy.
MBTA service cuts shortchange the needs of Boston's workers and ignore the sacrifices they make each day to keep our city running. Service cuts make buses and trains more crowded and undermining our efforts to stop the spread of COVID-19.